So Better Health of the Bush for us is very much about equity of access to primary care services, and that's really what we're about. And we know that in rural areas we have many GPs, allied health, primary care nurses, all working really hard. But access can be limited for people in rural areas, particularly in small-sized rural towns. So what we're trying to do is to look at how do we bring services together, how do we increase the collaboration in the primary care sector to really enable better access to primary care, but also starting to bring in innovative models of care. How do we utilise digital health, incorporate it into primary care to improve service provision? How do we bring multidisciplinary teams together, including allied health, nursing and medicine? And how do we bring students through in a clinic setting to help with the sustainability of a service? And all of those things are part of what we see as a more sustainable future for primary care. And they're all parts of this Better Health of the Bush model and important for us to have a look at.
UNE was involved with the Better Health for the Bush initiative since its inception. We come at it from the position of an educational partner, partnering with our clinical partners, the PHN and the local health district. As an educational provider, we can offer opportunities for clinical staff to be involved in training medical and health students, and equally we can provide some educational opportunities for the clinicians who are involved in the project. We know that residents in the New England Northwest have worse health outcomes compared to other parts of New South Wales and Australia, particularly metropolitan areas. And a lot of that comes down to access to health providers. So we have a paucity of health professionals in Glen Innes, and we'd like to increase access for the community of Glen Innes and its surrounds. One way of doing that is to offer different models of care that might utilise the skills of alternative health professionals other than doctors to work at the top of their scope in a regional area. And I think that's a really attractive thing for health professionals to be involved in.
We're seeing that access to primary care services in some areas is getting harder and harder. We see the opportunity in this model of actually bringing service providers together in a hub setting. So we see it as a way to increase collaboration of local services. We'd like the hub both to incorporate local clinicians and services, but also work in a really integrated and connected way with other local services.
For an example of how Glen Innes Health Hub will work, let's look at Mark. Mark, aged 55 from Glencoe, a town 24 kilometres south of Glen Innes, lives with chronic pain. Mark books an appointment with his existing GP, and at the appointment, the GP refers Mark to the Health Hub's group appointment for the exercise physiologist, as well as access to the Care Navigator service. Mark attends the group appointment with 6 other patients who also live with chronic pain. Mark learns about exercises to help with his chronic pain, and questions are asked by other patients that Mark hadn't thought of, but are relevant to him. This improves Mark's understanding further of how to manage his condition. Mark also meets with the Care Navigator, and they connect Mark with a local walking group, a men's group, and a dietitian online via telehealth. Mark feels supported and easily makes lifestyle changes through the Health Hub support and connection with local and online services.
One of the things that we know from the research, but also with talking to our staff, is that if they're supported and they have the opportunity to talk to peers and to have good supervision, that they're more likely to stay in our rural communities. This model will allow our staff to have the support of the university, to have the opportunity for further training and education, but also to act as trainers and for students. They'll have the opportunity to work with the local health district, so they might work part-time in the hub, but they might also come into our facilities and do some shifts, for example, if they're a nurse or an allied health person. I guess in addition to that is the connection with us, with the local health district, and the opportunity to work in our hospitals, in our community health services and interact with our large workforce. So it's a good, strong framework, if you like, good, strong collaboration between the University of New England, Hunter New England Health and the PHN.
We really want to connect. We'd like you to be involved. If you're watching this video and thinking this could be interesting, reach out to us, connect with us through the website, email, phone contacts that are on there, and get in touch, and we'd love to talk.